Alright, what is up YouTube? This is Ayush Sharma and welcome to Bodybuilding Fitness and Lifestyle. In this video, we are going to continue the Anabolic Steroid series, and this video is part 1 of module 2 where we are going to talk about some cardiovascular side effects of anabolics. So without wasting any more time, let's dive into this. What I have usually seen is most people don't even talk about these side effects. They only talk about enlarged heart and high blood pressure. But you should know each and every side effect that is associated with anabolic use. Now we are going to talk about polycythemia, and it is a fifth side effect. The other four we have covered in our previous videos, so you can check that out. Most anabolic steroids stimulate or increases the red blood cell production and especially the beta-durabolin. As the concentration of RBC will increase in our blood, the viscosity of the blood will increase, and if the blood will become too viscous, then its ability to move around will reduce, and it can increase the risk of embolism and stroke. Now take a look at this diagram, and here this is the blood vessel and these are the RBCs. Now if the amount of RBC will increase in our blood, then the blood's ability to move around will become impaired. So now how anabolic steroids increases the RBC concentration? So let's see it in this slide. So what anabolic steroid does is it increases the hematocrit levels by several points, which increases the blood viscosity. Now if you want to know more about this hematocrit levels, you can search it on internet and you will find a lot of information about this. But for now, this high hematocrit levels is believed to be a contributing factor in the deaths of a number of steroid abusers. But as always, this alone is not responsible. So what we have to do is we have to remain cautioned of the potential cardiovascular danger of hematocrit levels associated with anabolic steroid use. There are medications available which will make your blood thin, but if you are abusing anabolic steroids, then you are in a high risk zone. The sixth side effect which we are going to talk about is homocysteine. There is a possibility that anabolic steroids will elevate the level of homocysteine. But now what homocysteine is? So basically, homocysteine is an intermediary amino acid produced as a byproduct of methionine metabolism. And what is methionine metabolism? So if you want to know more about this, you can search it on internet. Elevated levels of homocysteine may also induce vascular cell damage. It supports platelet aggregation, and it also increases the likelihood of thrombotic event. Now, the average homocysteine level in bodybuilders who have never taken steroids was 8.6 micromole per liter, while it was 10.4 micromole per liter in long-term steroid users. One study also shows that administering 200 mg of testosterone ananthate for 3 weeks failed to produce a significant elevation in homocysteine. So if we use anabolics within the limit, then maybe it will not elevate the level of homocysteine, but individuals should remain warned of the potential elevations in the homocysteine level with steroid abuse. Now, if you want to know how to control the levels of homocysteine, you can comment it down below and I will make a separate video on how to control this homocysteine levels during steroid use. In this video, we have covered 2 cardiovascular side effects of anabolics, and there are a lot more side effects of anabolics which we are going to cover in our upcoming videos. So stay tuned for it. And if you have any doubt in this video, you can either DM me on Insta or you can comment it down below. Well, for now, if you learned something from this video or if you enjoyed this video, let me know by leaving a thumbs up and a comment below. By this, I, Ayush Sharma, signs off and have a nice day.